Welcome back to the deep dive. We're here again to try and cut through, all that noise from new research, new articles, all the breakthroughs happening. And today, we are plunging into a really dynamic field. Dermatology and immunology, the treatments are just advancing so quickly. We're talking common stuff like acne, complex things like autoimmune disorders. The whole therapy landscape is just, well, it's changing incredibly fast. Okay, let's unpack this. Let's get you informed.
Yeah, it's definitely more than just, a few new drugs here and there. It feels like a real shift. We're seeing this explosion, really, of innovation, everything from very specific topical creams, new oral meds, to these advanced biologics that can, target very specific immune pathways. So our goal today for this deep dive is really to boil down the most impactful stuff from the latest sources, give you those aha moments without getting totally bogged down. You'll hopefully understand not just what's new, but why it's actually important for patients and for where treatment's heading.
Exactly. Think of this as where your personal briefing. It's designed to give you that shortcut, right? To being genuinely up to speed on the cutting edge of skin and immune health. We're going to focus on those key nuggets of knowledge, the things that give you a clear picture of where medicine is going. Hashtag unpacking innovations in acne vulgaris and rosacea. All right, let's kick things off with acne. I mean, it affects millions, right? Globally. So first up, sarecycline. You might know it as Seysara, as an oral drug, once-a-day tetracycline class, approved in the U.S. for moderate to severe inflammatory acne in patients aged 9 and up. What's interesting here is its efficacy. Studies show it really reduces those inflammatory lesions compared to placebo, and importantly, safe, well-tolerated, low rates of side effects.
And what's insightful about sarecycline, I think, is that even though it's in a familiar antibiotic class, that once-daily thing and its sort of targeted spectrum, it makes it a more refined tool. It's convenient, it's effective for those inflammatory types of breakouts. But, beyond antibiotics, we're also seeing a much more sophisticated take on hormonal agents, especially for acne in women. Combined oral contraceptives, COCs, they're not just for birth control anymore. They're actually really effective and recommended for inflammatory acne. And for some patients, spironolactone can also be, well, a real game changer.
Okay, so we're talking more specific formulations then, not just general hormone balancing.
Precisely, yeah. We won't list every single one, obviously, but the FDA has approved several COCs specifically for acne. They recognize those targeted benefits, how they work, essentially. They sort of gently adjust hormone levels. They decrease androgen production, that's male hormones at the ovary. They increase a protein that kind of mops up extra testosterone floating around. So it helps calm down those hormonal drivers of acne, from the inside. Now, it is important, and you should know this, there is a potential risk, though it's generally manageable, of VTE, venous thromboembolism, blood clots in the veins. For women of childbearing age using COCs, it's definitely a discussion clinicians have, patient by patient, to ensure it's used safely.
That makes total sense. Okay, so we've got oral options, tackling things internally. But what about treatments you put on the skin? Topicals. Let's turn to clascoterone, 1-Level-I. Heard this is really a first-in-class topical, an androgen receptor inhibitor. Approved 2020, 1% cream, acne vulgaris, patients 12 and older. My question is, why is this such a big step forward?
Yeah, that's a fascinating one. It's a big deal because it gives you targeted relief right where you need it, on the skin. It's a potent competitor for testosterone right at the skin's androgen receptors. But crucially, no systemic effects in adults. So you're hitting that hormonal part of acne topically without messing with hormones elsewhere in the body. That's pretty significant, especially for long-term use, avoiding systemic side effects. Plus, it's already approved down to age 12, and there are studies looking at even younger kids, too.
Wow, okay. Sounds like a really powerful new tool for dermatologists, and I hear there are even more innovative acne treatments kind of waiting in the wings.
Oh, absolutely. The pipeline is pretty full, promising stuff. One that really stands out to me is Illumicostat glyceryl, DRM01. It's a 7.5% gel, still in trials. But the insight here is huge. It's the first time ever a topical sebum production inhibitor is being tried for acne. So instead of just dealing with the oil after it's made, it actually targets the enzyme that makes it, acetyl coenzyme, O-oxalase. That's a fundamental shift, right? Tackling a root cause right there on the skin. We're also seeing other novel things like Omeganin and its pentachloride. They're antimicrobial peptides targeting the bacterial membranes involved in acne. Pretty cool stuff.
Yeah.
Hashtag progress in alopecia and hair loss.
Okay, so from the complexities of acne, let's pivot a bit. Another challenging area, hair loss. Specifically, frontal fibrosing alopecia, FFA. That can be really distressing for people.
Yeah, FFA is tough. But for this condition, the role of 5-alpha reductase inhibitors, 5-ARIs, has really offered some hope. In the past, managing FFA often felt like, well, like you were just slowing an inevitable progression, hair loss along the hairline. But a recent review showed that patients treated with these 5-ARIs could actually achieve either disease stability, meaning it stops getting worse by, or even a reduction in how fast it's progressing. And that's significant because it provides a real therapeutic option, something to halt or slow down a condition that, frankly, had very few effective treatments before.
All right, now let's tackle some inflammatory skin conditions. Starting with atopic dermatitis, AD eczema, that intense itch and discomfort. We've seen abrocitinib emerge, right? A once-daily pill for moderate to severe AD. Adults and adolescents 12 and up, powerful systemic option. And then there's the topical side. Ruxolitinib 1.5% cream, Opzelura, FDA approved September 2021. You mentioned this is a first-in-class topical JAK1, JAK2 inhibitor for mild to moderate AD. Can you break that down a bit? What's a JAK inhibitor and why is this cream so exciting for AD?
Absolutely. So think of JAK enzymes, JTAs, as key messengers inside your skin cells. When they get activated, they basically signal the cell, okay, time to cause inflammation, time for that intense itch. Ruxolitinib cream, being a one JAK2 inhibitor, it essentially blocks those messengers right at the source on the skin, so it gives targeted relief from the intense itch and redness of AD. Why it's exciting? It's a powerful, non-steroidal, topical option, great for patients maybe not responding to older treatments, and it's approved for short-term use or non-continuous chronic treatment. Gives clinicians another tool for managing those really frustrating flares.
Oh, and speaking of AD, just a quick note on tralokinumab. It's worth knowing conjunctivitis, eye inflammation's a pretty common side effect. Something to watch for.
Okay, that's a great explanation. Highly targeted, even in a cream. So how does this compare to maybe more complex autoimmune conditions like pemphigus vulgaris, where the body's own immune system attacks the skin? Well, if we connect this to the bigger picture, like autoimmune conditions, we see similar kinds of smart advancements in pemphigus vulgaris too. Rituximab, that's a monoclonal antibody, it's been studied quite a bit for managing pemphigus, whether it's early on or relapsing later. What's particularly insightful, I think, especially when you look at pediatric cases of these autoimmune blistering diseases, is how we can now measure treatment impact better. There was a study showing patients treated only with glucocorticoids, steroids, they had a much higher glucocorticoid toxicity index, GTI, compared to kids who got steroids plus rituximab. And this GTI, it's a really valuable tool. It actually quantifies the side effects, the toxicities of steroids. That allows for more precise treatment plans, better management of side effects, especially crucial in children where steroid side effects are a major concern.
Okay, next up, let's dive into psoriasis. That world seems to be constantly evolving, new options popping up all the time. Bimekizumab, an anti-IL-17 therapy. Got marketing authorization in the EU, August 2021, moderate to severe plaque psoriasis in adults. For our listeners, what does targeting IL-17 actually mean in psoriasis?
Right, so targeting IL-17 is a very focused approach. Interleukin-17, IL-17, it's a specific inflammatory messenger protein. It plays a really central role in driving that rapid skin cell turnover and inflammation you see in psoriasis plaques. So by blocking IL-17, bimekizumab essentially interrupts that whole inflammatory cascade, leads to clearer skin. It's given as a subcutaneous injection under the skin, and it's also been approved for psoriatic arthritis, which shows it can help with both the skin and the joint problems some patients have.
Sounds like a powerful biologic option, but I've definitely heard buzz about an oral treatment for psoriasis that's making waves. Sotyktu.
Yes. Okay, here's where it gets really interesting, I think. So Sotyktu, or deucravacitinib, FDA approved September 2022. An oral treatment for adults, moderate to severe plaque psoriasis. Just imagine that. The convenience of a once-daily pill for a condition often managed with injections or, constant topical creams, especially for people who've struggled with sticking to other treatments or had side effects. But the real insight here, it's the mechanism. It's the first allosteric TYK2 inhibitor. That means it works in a totally new way compared to other drugs. It offers a completely different pathway to relief for patients maybe who haven't responded well before. It could potentially transform adherence, quality of life. Yeah, it's a pretty significant achievement for patients and doctors.
Wow, that is a huge step forward. Convenience, new mechanism. Brilliant. And the advancements don't stop there for psoriasis, do they?
No, they certainly don't. Risankizumab Arza, that's Skyrizi, got FDA approval January 2022 for active psoriatic arthritis. Expands the options there. And then there's a really severe form, generalized pustular psoriasis, GPP spesolimab, or Spevigo, got FDA approval September 2022 specifically for GPP flares in adults. That's its first approval for that specific, often dangerous condition. It fills a really critical unmet need.
So we're seeing both broad approaches and these incredibly specific targeted ones. What about new topicals for psoriasis? Anything happening there?
Yes, topical progress is still really important too. Roflumilast, 0.3% cream, FDA approved July 2022, topical treatment for plaque psoriasis. And importantly, it includes use in intertriginous areas, skin folds, which can be tricky to treat. For patients 12 and up, that's helpful because those areas are sensitive, and this gives a safe, effective option. We also saw VTM, that's tapinarof cream, approved back in May 2022. So yeah, the topical arsenal is definitely growing too. #tag advancements in lupus erythematosus and dermatomyositis.
Okay, let's shift focus again. Other complex autoimmune conditions. How about dermatomyositis? That rare inflammatory disease affects muscles, skin, intravenous immunoglobulin, IVIG. It's already approved for other things, right? But now may be used for dermatomyositis. I read the approval came from strong phase 3 results, the ProDerm trial. Showed much higher response rates. That sounds like a game changer, offering a new path for managing a really tough disease. But it's crucial we mention the boxed warning, isn't it? Potential for thrombosis, kidney issues, acute renal failure with IVIG. That's not trivial. It's a major safety point.
Absolutely. That's an excellent point about the boxed warning. It really highlights that balance, efficacy versus safety, with these complex treatments. And beyond IVIG, other therapies are proving relevant in these related areas too. Tocilizumab, for instance. Monoclonal antibody targets IL-6, another key inflammatory protein. It's being used for specific complications like interstitial lung disease, lung problems that can happen with systemic sclerosis, another complex autoimmune condition affecting connective tissue. And lenalidomide is also mentioned as another therapy in this kind of category. It just shows the varied approaches, sometimes overlapping, that are needed for these multi-system conditions. #tag new strategies for chronic urticaria.
All right, let's move to chronic spontaneous urticaria, CSU. Those persistent hives, the itching, can be incredibly debilitating for people. Novartis has ledolizumab. That got FDA breakthrough therapy designation January 2021. That signals it could be a big improvement, right?
Yeah, breakthrough designation is always a good sign. But what's perhaps even more exciting right now is remibrutinib. This is a novel covalent oral inhibitor of something called Bruton's tyrosine kinase, or BTK. You can think of BTK as like a crucial on switch. It activates certain immune cells, mast cells, basophils, which are central to the allergic type reaction causing urticaria. So this drug basically keeps that switch turned off, prevents the overreaction causing the chronic hives. Early data looks really promising for efficacy and safety. It offers a new targeted oral approach for a condition that can be really, really challenging to manage.
And looking at who gets chronic urticaria, the sources pointed out a big female predominance, over 76% of cases. Average age around 42. It's fascinating, too, that researchers found two distinct groups based on the immune cells present in biopsies, but it didn't strongly correlate with regular lab tests. That just highlights how complex this condition is and exactly why these targeted new therapies are so important. #, broader impact and emerging trends.
Yeah, and beyond these specific disease areas, we're seeing some broader anti-infective developments, too, worth mentioning. Oteseconazole, VIVJOA, FDA approved April 2022. First and only treatment for recurrent yeast infections, vulvovaginal candidiasis. It's designed to hit a specific fungal enzyme, CYP51, without messing with human CYP enzymes. That's a big step for targeted antifungals, minimizing side effects. And then for urgent situations, tecovirimat, TPUXX. Originally for smallpox, it's now authorized through a special CDC protocol for treating monkeypox. What's really important there is that doctors can actually start treatment before all the IND paperwork is done, critical in a public health situation. We're also seeing new IV and oral antibiotics added to the list, like omadacycline and delafloxacin, broadening our toolkit against bacteria. That rapid access, that's huge. And it brings us to another critical point.
Yeah.
Kids. Pediatric considerations. Specific age, weight guidelines are so important for safety and effectiveness, like ivermectin. Approved for scabies in some places, but using it off-label in infants. Kids under 15 kilograms, not recommended for babies under 6 months. Or spinosad suspension for head lice. Okay, for 6 months and up, but its safety for scabies isn't established in kids younger than 4. These details seem small, but they're incredibly important for parents, for clinicians.
Exactly. And one last one for folks dealing with hyperhidrosis, excessive sweating, specifically under the arms. Glycopyrronium tissucillate, it's showing real promise. Phase 3 data from back in February 2018 showed this topical investigational therapy improved severity, actually reduced sweat production, and really improved quality of life. Specifically for pediatric patients ages 9 to 16 with primary axillary hyperhidrosis. It just highlights how even for conditions that aren't life-threatening, these targeted therapies can make a massive difference in someone's day-to-day life. Hashtag AttraPeople.
Wow. What an incredible deep dive that was. We've really covered a huge amount of ground. Amazing advancements, highly targeted pills for psoriasis, innovative topicals for acne, new hope for rare autoimmune diseases, the pace, the specificity of these new treatments, it's truly transformative. So what does all this mean for you, listening? Well, it really points to a future where treatments are getting much more targeted, often more convenient too, and ultimately more effective, bringing relief, better quality of life to millions of people.
Yeah, and if we connect this to the bigger picture, the knowledge you've gained today, it really shines a light on this clear trend towards precision medicine, doesn't it? We've seen this rapid evolution from, general antibiotics years ago to highly specific anti-IL-17s, these novel BTK inhibitors, even first-in-class topical sebum blockers. So considering this breadth, all these new, highly specialized therapies, here's something to think about. What implications do you think this trend has? For accessibility, maybe, for cost, and for the continued search for even more personalized treatments over, say, the next decade? It's a really powerful question for all of us to consider moving forward.
That is a truly thought-provoking question, and one that will definitely shape the future of healthcare, access, everything. Thank you so much for joining us on this deep dive today. We really hope it sparked your curiosity, equipped you with some valuable insights. Keep exploring, stay curious, and we'll see you next time.